The National Collaborative for Health Equity invites you to listen to part two of a two-part conversation about food justice and sovereignty.
So, quick question. How do you teach your students and all of the entities that you work with? Because you're not just a professor, you're a professional. But how do you teach the individuals that you're working with, the organizations, um, how to identify and prevent these injustices that we're talking about today?
So, one of the courses that I teach is called Community Assessments and Partnerships. And it's really basically like a DIY 101. How do you do exactly what you just described, community participatory based research or work, where anyone with any expertise, and that term makes me cringe because lived experience isn't necessarily considered expertise, but it 100% should be. It's as valuable, if not more valuable, than a piece of paper. Um, but all of that information on helping making sure that the community has the necessary skills and understanding of how to identify not just what the problems are, which everyone likes to talk about the problems, everyone knows what the problems are, but understanding the problems within the context of what resources are available, what strengths do the community members bring to it, what hopes and dreams do the community members have, so that you can look at, here's the problem according to the people in the community, here's the problem according to what literature says, and now let's work together to try to understand what that problem is and how to have a solution to it. So, talking with students about the process of how you do that, how you go into an area with humility, again, referring to community participatory based work, in a way where everyone's working together for a common good. And then also understanding that you don't know what you don't know until you know it. So, conversations are important, building relationships are important. And the research and work I've done, I've always been surprised. And at this point, I probably shouldn't be, that the biggest value that people have is relationship with each other. So it doesn't matter if I'm asking about food accessibility. It doesn't matter if I'm asking about their health care. It doesn't ask or matter if I'm asking about shelter or whatever the topic is. At the end of the day, when you talk about resources, you talk about what matters most to people. It's the people in their life. So helping people identify that people are valuable, having those conversations with each other so that they can hear from them what's most important, what they want, but then also what they can offer to have a solution to the problem. Because often people with the paper expertise who really mean well have no clue, again, to the lived experience of the people with whom they're working, and then going in and making recommendations that aren't feasible. Like, for example, if a doctor's telling a patient who has type 2 diabetes and is obese and has cardiovascular disease, well, stop eating deep fried Twinkies and eat more kale. That's not helpful. That's insulting. But instead, telling them, okay, well, it would help you if you made some adjustments to improve your health. How can we do that? What sorts of foods will you eat? To your point earlier, Treasure, if there are religious food restrictions, if there are cultural food restrictions, how can we work together to find food that you want? How can we understand who you are as a person so that any recommendations that we come up with are a collaborative effort rather than a top down, condescending, I'm telling you what to do because I'm the person who knows better, which just does only breeds more mistrust and distrust historically. So, thinking about innovation and thinking about challenges and thinking about the importance of community, when I know that in some of the communities in which I've worked, especially with the food as medicine space, that diversity is beautiful and it's wonderful, but it can also lend to not knowing exactly how to address a problem because there are so many people with so many preferences and so many needs. LA, as you've discussed, is very diverse. So, how have you found that diversity influences the work that you do to try to help support food sovereignty?
Oh, I mean, it adds to the challenge for me, which makes the work great when I'm able to like break past that barrier, right? But like it is such a wide space. We're very like large and wide and far, and our public transit system contributes to that. Clearly, I work in the urban planning space, right? So I'm thinking of how all of these things impact access, right? We only have so many buses. We're not like New York where there's tons of trains, maybe subways, that allow people to get somewhere very quickly and easily. The bus might only come every 45 minutes. That might not make it easy for you to get to the store before it closes and get home on time to pick up your kid. Or maybe you don't have the ability to carry 3 bags of groceries in order to make that one good fresh meal. So, really considering those sorts of things, how urban planning in your place, your zip code really impact that. But also recognizing like diversity in LA looks like socioeconomic status, it looks like ethnicity, it looks like religion, it looks like the intersection of all of those things. I'm a Black educated woman who grew up in this space, right? That doesn't make me the same as another Black educated woman. There's so many other things that divvy us up, and not in a bad way, but just recognizing that and holding space for those differences, and treating them, like you said earlier, as equal, of equal value. And so I think Los Angeles provides the best kind of learning space for that. And then all of the experiences that I've had professionally and academically have allowed me to kind of play around with that and see how I can make it better. So, for example, oh, and then one last thing, there's a lot of compounded traumas and stresses. I think you were speaking to that earlier about your lived experience, just recognizing that. I'm from Pasadena, California. There was redlining here at one point, right? That has contributed to Altadena being more diverse a bit than Pasadena is. And so when we had these LA fires here earlier this year in January of 2025, Altadena is the city or the town that burned down. And so recognizing again, there were already people who were struggling with food access because of the economic constraints that COVID had put on us. I was doing research in the Southern California area around COVID zones who were still trying to recover from something, the pandemic that happened 4 years prior. So just recognizing how one thing that doesn't impact people 10, 15 miles away, Westwood and Beverly Hills are about 20 miles from Pasadena, just 20. And they're living a very different experience than those in Pasadena or those in Watts, right? And so recognizing that's the kind of challenge that you're getting when you're dealing with a space as diverse in all of these ways as Los Angeles. People are having different stories and living different truths. And so, to your point, when a large organization or the corporation that has the money comes in and doesn't really take into account the lived experience of the people that they're trying to help, they end up botching it. And again, the intention might be beautiful and great, but they're not taking into consideration the fact that, you know, Mr. Craig or Johnson have this additional information. They know what the system has been like for 30 years in that space. They've lived there. This is their mama's house that they inherited. And so they know these people very well. They know what's trusted, they know what's not. Being able to take that and then put it into your research approach or your treatment for that space alongside them, having their buy-in sometimes gets the community's buy-in. You recognize the influence they have. Those are the relationships that you have to continue to build in a space as diverse as this. And to your point, practicing humility, recognizing your biases, I think is really, really important. And so I utilize the Johari window method. And just look it up, Johari. Two founders, Joseph and Harry. Really a unique way they titled it. But yeah, it just allows you, to your point, to focus on like these four windows. What I know, what you know, what we not like both of us don't know, and then what both of us don't know that we don't know, right? There's knowledge that I have, but I don't know that I don't know about certain foods until I learn about them. And so recognizing that there's always some space for us to learn, and Los Angeles is one of the most beautiful places to be able to do that, especially when you have a breakthrough, to see the looks on people's faces when they feel heard and when they recognize that they can do it again without your help, that they don't have to utilize you as a crutch. They now feel empowered. Best feeling in the world. What innovative ways have you been able to address food sovereignty and bring that about?
Oh, good question. I consider myself a public health cockroach. I go anywhere, do anything to try to make a difference. And to your point, hearing lived experiences from people, I love storytelling. I love hearing people's stories. I love learning, continuing to learn how to improve what I'm doing, but also learning new skill sets. So in the food sovereignty work, my methodology is a bit possibly unique, based on that cockroach, but not actually bringing cockroaches into the conversation in reality. But thinking, what resources do people have in their own environment? What are their cultural preferences? What are some things that may not be preferential to me as a person, but it doesn't matter at the end of the day because it's part of who they are, their culture. I think it ultimately goes back to what people have available in their own backyards, in their own environment. So for people in rural environments, that may look like hunting or fishing or having gardens or learning how to make mixes so they don't have to be dependent on extra trips to the grocery store. It may look like having indigenous knowledge from those regions shared so that that can be incorporated. It may look like foraging things in people's backyards. It may look like baking parties in a neighborhood where people are able to teach each other skill sets that may once have been commonplace, but now may not be so much commonplace. It looks like communities working together. So a grandma teaching her granddaughter how to bake cookies, a daughter teaching her mom how to make jam, understanding what foods are acceptable to different cultures, understanding what foods are a part of different cultures, celebrating that, not shaming it, never having any sort of shame associated with food, celebrating food, but understanding at the end of the day that many communities have exactly what they need to survive and thrive, not just that survive bit. They may not have the knowledge of what to do to use those resources, and they may not have the knowledge of how valuable those resources truly are. So learning from each other is a beautiful way to help foster that food sovereignty and to help them celebrate the resources that they have.
I want you to tell me a time where maybe you felt like the most impactful moment for a community member in food sovereignty.
So a number of years ago, I did some work in an elementary school in an inner city and asked the kids questions before I started the nutrition program just to understand where they were at. And out of all of the work that I've ever done, this one quote has stood out the most because it was a second grade girl, little sweet girl. And when I asked her about her knowledge about fruits and vegetables, she didn't know that grape was a fruit. She thought it was only the flavor of a slushy, had never had grapes before, had never encountered grapes before, just knew it as a slushy flavor. And just seeing that that was a second grade kid in America really put into perspective the fact that we have a lot of work still to do.
We do. I agree.
At the end of the day, so all of these things we've talked about, the problems, the challenges, the solutions, the joys, the hurts, everything. At the end of the day, if I were to ask you what success looks like in your field, in your space, what would you tell me?
So success looks like people in the community that we work with being able to take on these sorts of projects on their own, feeling empowered and emboldened enough to move forward with processes like this in the future, maybe around a different topic, right? So we're addressing food sovereignty and swamps and inequities, but maybe there's something else around health equity or community needs that they feel also needs to be addressed. Typically, that's the case if we're talking about food sovereignty. There's something else going on in that neighborhood as well. And so just being able to know that we've empowered them, the joy, the pride that you see on an elder's face when they're like, I knew I was right, this thing needed to change. And thank you for listening to me. Those sorts of priceless moments are the things that feel like success to me. It's not necessarily like this data or statistic. It's just knowing that these people know how to move forward within this oppressive system um, and make it work for themselves. Change the things that need to be changed, call out the things that need to be called out, and not accept anything less than what is valuable to them. So that feels like success to me. I'm going to ask you the same question, actually, MB. I just want you to tell me what does success look like? Can you define that and maybe share a great example of what that looks like for you?
Success for me looks like people talking together, people connecting together, people having hope. And an example of that, I was part of a research project over this past summer where I had the privilege of interviewing some homeless individuals in the DC metro region. And when talking with them, just hearing about their experiences, the quote that stood out to me the most is that hope is the most important commodity that anyone can have. If they don't have hope, then there is nothing left. So, and within that context, I think It's easy to be overwhelmed with the sheer vastness of the problem. It's easy to be overwhelmed with the concern of how that problem will impact people. But at the end of the day, if we have hope that there are people like you, Treasure, or there are so many other people that do the right thing quietly, there's hope for change in our country. And that's the most beautiful piece of success of all.
I 100% agree with you. There are hundreds of thousands, maybe millions of Mary Beths and Treasures around this world trying to make change. There's NCHE doing this great work and making sure that the information is spread widely with podcasts like this. Um, and so I have hope, that keyword, that this will be a better place in the next few years. It won't take very long.
100% agreed. So, Treasure, takeaways for people listening. If you could summarize all of your passion, thoughts, ideas into one or two or three sentences, what would you want that takeaway to be?
Oh, the power is in the people's hands. We need to allow them to make decisions for themselves. Government entities, large corporations, the people with the 1%, the money, need to really give back that power to the community members. They know what they need, they know how they need to do it. They just need the authority to do so. And yeah, that's what we're doing right now, step by step. Same question for you, though, MB. What would you say?
I'd say that at the end of the day, there is hope. It doesn't matter who's in charge politically. I mean, it does matter, but ultimately, that as long as human beings hold on to hope and continue to work together for a common good, then no matter what else is going on in the world, what needs to be done will still happen. So hold on to hope.
Amen. I agree.
Thank you so much, Treasure. It's been an absolute joy talking with you and hearing about your work.
Same. Thanks, Mary Beth.
For additional information, visit nationalcollaborative.org/hope in action.